Urinary tract infection. Case discussion. RG, 32-year-old female, 5 months age of gestation, with chief complaint of dysuria. Clinical history. 48 hours prior to consultation, she started experiencing acute onset of painful urination accompanied by lower abdominal pain of moderate intensity. She was advised to give a urine sample for urinalysis. Physical examination of the patient. Patient has a body temperature of 36.8 Celsius. Heart rate is 80 beats per minute. Respiratory rate is 22 to 23 cycles per minute. Patient was negative for pelvic or kidney punch, however, positive for hypogastric tenderness. Urinalysis result. Physical examination. The color of the urine is yellow, while the transparency is turbid.
Chemical analysis. In a person with UTI, the chemical analysis will detect nitrates, protein, white blood cells, and blood in the urine. Nitrates are byproducts of bacterial metabolism. Protein is detected because the bacteria are made from it. The blood is present in the urine as a result of inflammation caused by bacteria.
In a UTI urine sample, the lab tech will see bacteria, red blood cells, white blood cells, and strand of protein through the microscope.
Leukocyte esterase. Normally negative. Leukocytes are the white blood cells or pus cells. This looks for white blood cells by reacting with an enzyme in the white cells. White blood cells in the urine suggest a urinary tract infection.
As a student nurse, the 3 possible health teachings that I can provide to the patient are the following. First, the patient must drink 8 ounces of water per day to flush bacteria out of the urinary system. Second, the patient should always wipe the perineal area from front to back following urination or defecation in order to prevent introduction of gastrointestinal bacteria into urethra. Third, patient should practice frequent voiding every 2 to 4 hours to flush bacteria out of the urethra and prevent organisms from ascending into the bladder. Void immediately after intercourse. And lastly, the patient should avoid tight-fitting pants. Wear cotton rather than nylon underclothes. Accumulation of perineal moisture facilitates microbial growth, and cotton enhances ventilation to perineal area.
Normally, urine and all of the organs and structures of the urinary tract are sterile and contain no microorganisms. However, infectious microorganisms can get into the urinary tract from outside the body through the urethra and cause urinary tract infections. Infectious microorganisms can also travel through the bloodstream from other parts of the body to cause urinary tract infections. Urinary tract infection, or UTI, is a bacterial infection that affects any part of the urinary tract. Urinary tract infections include bladder infection, bacterial prostatitis, which is a urinary tract infection of the prostate gland, and pyelonephritis, a urinary tract infection of the kidney.
The mode of transmission of the bacteria, particularly the E. coli, is through sexual intercourse, poor hygienic practices, and acquired nosocomial infections during catheterization.
Epidemiology. Women, in particular, are common to the bacterial infection in the urinary tract, or most commonly called
UTI. This is due to the proximity of females' urethral orifice, the vagina, and anus opening. This infection in men is less common because of the differences in anatomic structure and changes in sexual maturation, pregnancy, and childbirth. The most common etiologic agent in UTI is the presence of Escherichia coli. The major risk factor for the development of UTI is the obstruction of urinary flow from any underlying cause. In men, the main contributor of UTI is observed in the age of more than 50 years old, where a nodular enlargement of the periurethral zones of the prostate gland cause compression of the urethra with partial obstruction to the urinary flow. The enlargement of the prostate gland of men is called benign prostatic hypertrophy.
Prevention and management. First, drink at least 8 to 10 glasses of water. To prevent UTIs, drink lots of pure water. This will increase the flow of urine and flush bacteria out of the urethra and bladder. To reduce the chance of a UTI, urinate after sexual intercourse to flush the bacteria out of the urethra. Third, one should practice frequent voiding to flush the bacteria out of the urethra. Fourth, wearing tight synthetic clothing can also irritate the urethra. Loose-fitting clothing or skirts and cotton underwear help to reduce irritation. Fifth, avoid sugar. During an acute or chronic infection, avoid consuming sugar and refined foods to help your immune system work optimally. Bacteria use sugar in the blood as food. This is one reason that diabetics and pregnant women have more frequent urinary tract infections. Sixth, drink cranberry juices or eat cranberries. Cranberries and cranberry juices are particularly beneficial in treating UTIs because they prevent bacteria from sticking to the bladder's walls. Seventh, identify and avoid food allergies. One of the symptoms of food allergies is frequent urinary tract infections. Identifying and avoiding your food allergies can help your immune system work more efficiently and can decrease the inflammation in your body. 8. If recurrent infection still persists, suppressive antibiotic therapy can be given. And lastly, the most important thing you can do to avoid urinary tract infections is to always wipe from front to back after using the bathroom. Do not go forward again after wiping from the back. Most UTIs are caused by E. coli, which comes from fecal matter contaminating the urinary tract, usually from not wiping correctly after using the bathroom.
UTI can be treated through an oral antimicrobial chemotherapy. Antibiotics such as beta-lactam agents such as amoxicillin and cephalosporin group, trimethoprim, sulfamethoxazole like Bactrim and Septra, or a fluoroquinolone like ciprofloxacin or levofloxacin. Uncomplicated UTI often responds to oral chemotherapy either in a single dose or for 3 days, depending upon the drug itself. Prolonged infections, such as more than a week, accompanied with other complications, should be treated with longer courses of antibiotics, usually 10 to 14 days.